Hello everyone and welcome to our presentation on the Texas Occupational Therapy Documentation Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Occupational therapists may evaluate the client to determine the need for occupational therapy services without a referral. However, a referral must be requested at any time during the evaluation process when necessary to ensure the safety and welfare of the client. Intervention for a medical condition by an occupational therapy practitioner requires a referral from a licensed referral source. Note that a referral requirement is for a medical condition, but not a non-medical condition. A medical condition is a condition of acute trauma, infection, disease, process, psychiatric disorders, addictive disorders, or post-surgical status, synonymous with the term healthcare condition. Non-medical condition is a condition where the ability to perform occupational roles is impaired by developmental disabilities, learning disabilities, the aging process, sensory impairment, physiosocial dysfunction, or other such conditions that do not require the routine intervention of a physician. Referral sources can include a physician, a dentist, a chiropractor, a podiatrist, or another qualified licensed healthcare professional who is authorized to refer for healthcare services within their scope of practice. A practitioner's referral may be transmitted in the following ways: by a written document, including paper or electronic information communications technologies, verbally, either in person or by electronic information technologies. If a referral is transmitted verbally, it must be documented by the authorized personnel who receives the referral. Authorized personnel means the staff members authorized by the employer or the OT to receive referrals transmitted verbally. Or by an occupational therapy plan of care developed according to the requirements that is signed by the licensed referral source. A screening, consultation, or monitored services may be performed by an occupational therapy practitioner without a referral. The occupational therapist is responsible for determining whether an evaluation is needed and if a referral is required for an occupational therapy evaluation. Only an OT may perform an initial evaluation or any reevaluations. An occupational therapy plan of care must be based on an occupational therapy evaluation, and the OT is responsible for determining whether an aspect of the evaluation may be conducted via telehealth or must be conducted in person. The OT must have contact with the client during the evaluation. The contact must be synchronous audio and synchronous visual contact, that is in person via telehealth or via combination of in-person contact and telehealth. Other communications or information technology may be used to aid in the evaluation, but may not be the primary means of contact or communication. The OT may delegate to an OTA the collection of data for the evaluation, but the OT is responsible for the accuracy of the data collected by the assistant. Only an occupational therapist may initiate, develop, or modify or complete an occupational therapy plan of care. It is a violation of the Occupational Therapy Practice Act for anyone other than the OT to dictate or attempt to dictate when occupational therapy services should or should not be provided, the nature and frequency of the services that are provided, when the client should be discharged, or any other aspect of the provision of occupational therapy. Modifications to the plan of care must be documented. An occupational therapy plan of care may be integrated into an interdisciplinary plan of care, but the occupational therapy goals or objectives must be easily identifiable in the plan of care. Only occupational therapy practitioners may implement the written plan of care once it is completed by the OT. Only the occupational therapy practitioner may train non-licensed personnel or family members to carry out specific tasks that support the occupational therapy plan of care, and the OT is responsible for determining whether intervention is needed and if a referral is required for occupational therapy intervention. The OT or OTA providing occupational therapy services must document for each intervention session. The documentation must accurately reflect the intervention, decline of intervention, and modalities provided. In each intervention note, the OTA must include the name of an OT who is readily available to answer questions about the client's intervention at the time of the provision of services. An OT in the intervention note may be different from the OT who wrote the plan of care. The OTA may not provide services unless this requirement has been met. Only an occupational therapist has the authority to discharge clients from occupational therapy services. The discharge or discontinuation of occupational therapy services is based on whether the client has achieved predetermined goals, has achieved maximum benefit from occupational therapy services, or when other circumstances warrant discontinuation of those services. The OT must review any information from the OTA, determine if the goals were met or not, complete and sign the discharge or discontinuation of services, and or make recommendations for any further needs of the client in another continuum of care. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.